Welcome, everyone, to our webinar today. I'm Vanessa Weisbrod, the Chief Education and Community Engagement Officer at the Celiac Disease Foundation, and I'm excited to be here with a wonderful group. We have Dr. Edwin Liu and Dr. Marisa Stahl from Children's Hospital, Colorado, and my co-host here, Deborah, will introduce herself, and we'll get into a very exciting topic.
Hi, I'm Deborah Silberg. I'm the Chief Scientific Officer of Beyond Celiac and happy to be here talking about a screening symposium. And I'm going to hand it over to Ed and Marisa to talk about the symposium.
Wonderful. Thank you so much, Deb and Vanessa. We're really excited to be here today and to talk about the first annual International Celiac Disease Screening Symposium, which was held in Denver in November of last year. The symposium brought together 25 leading experts from 5 different countries, all focused on advancing our understanding of celiac disease screening. Throughout this event, we explored a critical range of topics, including effective screening strategies and the evolving epidemiology of celiac disease worldwide. We had some key discussions that included the best approaches to screening, particularly in high-risk populations, and the important consideration of how to manage celiac disease, autoimmunity that's identified through screening. We highlighted the latest developments in research and talked a lot about the current landscape of celiac disease screening studies. And as we move forward, the goal is really to refine these strategies for early detection and intervention, overall to improve the lives of individuals living with celiac disease.
And the motivations for doing this screening symposium really were to, first of all, we've had a long-term interest in celiac disease screening, and there's an obvious clinical need for this. And also because there's an adjacency to type 1 diabetes screening efforts. We are part of the ASK study, which stands for Autoimmunity Screening for Kids, which is doing free screening for type 1 diabetes antibodies and also celiac disease. So in a lot of ways, we're already doing this. And we just need to make that extra push to try to develop policy towards mass screening. In addition to this, in September 2023, there was Italian legislation that mandated childhood screening for celiac disease and also type 1 diabetes. And so this is good that we're starting to really talk about this. And finally, screening perspectives may change, especially with the advent of new drugs coming down the pipeline. And so the overall outcomes from this symposium were that first, we garnered really intense interest worldwide on this. And we were able to identify critical gaps in knowledge that would help us direct research and future discussion. We've identified core personnel and core elements to really continue to advance this field as a team. A summary of the symposium is going to be submitted to a GI journal for publication. And then as a collaborative effort between NASPGHAN and ESPGHAN, that's a North American GI group and the European GI group, a state-of-the-art review is going to be done jointly as a sign of unity. And so this has really allowed us to gain great momentum to hold yearly symposiums. And as we start to approach this from like the policy standpoint, to really start to understand patient and provider perspectives, and then really also initiate great collaboration with the diabetes group, the Breakthrough T1D.
As an attendee of the symposium, it was an excellent symposium and brought together just wonderful people. But I'm going to start to ask you some questions, though. We can get a little bit more into depth. What do you think are the biggest challenges in the current approach to screening for celiac disease? And how do you see these evolving in the next decade?
Yeah, I think that's a really great question. So a big challenge in our current approach to screening is a reliance on symptoms and other high-risk features. Most people living with celiac disease may not have any recognizable symptoms or a family history or another diagnosed autoimmune condition. So the only way to really aid in early detection for these individuals is a general population screening approach. My hope is really that in the next decade, we rely less and place less emphasis on the recognition of symptoms and other high-risk features. I think we also need to be able to better educate patients, families, and healthcare providers on the importance of celiac disease screening and what to do when individuals screen positive for celiac disease.
And from my perspective, I think a big challenge is going to be the acceptance publicly and also medically from the communities. I think there could be a lot of resistance to screening, and it's going to be really important for us to understand what the barriers are. And this will also affect the way we decide to do screening. So, for example, there's going to be a huge difference between eventually doing something that might be mandatory, like mandatory testing of school-age children, versus providing the opportunity to screen and prompting providers to do this.
It's clear that a lot of education will be necessary wherever we land from all of this. So there is so much ongoing debate about whether universal screening for celiac disease should replace the current symptoms and risk-based approaches. What are the key factors influencing this decision, and what research is still needed to make a case for broader screening?
Yeah, so most individuals living with celiac disease will not be identified with a symptom and risk-based approach for screening. We really feel that early detection is key in improving outcomes and preventing complications. But this needs to be weighed with the potential impacts of how difficult it can be to be on a gluten-free diet for people that are completely asymptomatic, and just more broadly, right? And so I think that's a gap that we need to address, as well as the cost effectiveness of a more universal approach to screening, because it will obviously be more expensive to screen everyone.
And I'm always going to keep giving my perspective after this. The current way of testing is really missing most people with celiac disease, right? It's really not working. And we should really be giving doctors and patients, at the minimum, permission to screen anyone for celiac disease. The only thing is, like, in order to get this into policy, we have to prove that there's significant benefits, in particular to those people who don't appear to be suffering from symptoms of celiac disease, meaning they don't really have a whole lot of symptoms, and whether or not we can actually make their lives better by making the diagnosis.
So one of the barriers usually one of the barriers is the blood test that has to be done. Do you see any advances or emerging technologies that can help us improve early and widespread detection of celiac disease, biomarkers or other advances?
Yeah, I think there's a lot of exciting technology out there. I think right now we're not in a spot where that technology is replacing a blood draw, but there is technology that allows us to test for multiple autoimmune diseases at once. So we can screen for diabetes and thyroid disease and celiac disease all at the same time with one blood draw. And I think that's an exciting advancement that will make it easier for patients and also more cost effective to screen. There are point of care tests that allow for like a simple, finger poke, that might make it a little bit easier too. And then there are other tests under development, such as salivary tests that aren't ready for prime time right now, but I think could be an exciting non-invasive option in the future. I think the other thing is, we already do a lot in the way of newborn screening. And so advances in things like genetic risk scores, where we can use maybe like dried blood spots from newborn screening tests, would actually potentially allow us to better predict who's at risk of celiac disease and therefore develop kind of more personalized screening recommendations.
And for widespread screening, I still think it's going to be serologic testing for now, right? That's really our best way. And maybe someday in the future, there could be comprehensive genetic testing that can help us predict those at highest risk. But for now, like I said, there's going to be a limit as to just how far genes can take us. Especially since there's still a huge role of the environment in developing disease that's really hard for us to measure. But maybe in the future, like there'll be like a really refined immunologic test, such as the ones being identified now to look at, for example, IL-2 responses to gluten exposure in the blood, that could become a screening tool if it could be done in like a high throughput fashion. And if so, then that could be really the next big thing.
So Ed, you mentioned cost earlier. What are the cost implications of expanded celiac screening, and how can we ensure equitable access to testing for all patients, including those in underserved communities?
Yeah, so screening will help us diagnose more individuals living with celiac disease. There is a cost to that. But this should make celiac disease diagnosis more equitable. You know, one unintended consequence may be that identifying more celiac disease in some of these underserved communities that don't have adequate access to gluten-free diet education or gluten-free foods, or healthcare providers with expertise in celiac disease. And so I think one way that we can help address this, because we want to make sure that there is equitable access to screening, but also equitable access to resources, right? And so we need to work on the ability to provide remote resources for education and more national programs. And I know that this is already underway, but for things like food insecurity, and make sure that we're partnering really with primary care providers who are in those communities to give them the expertise and guidance that they need for celiac disease management.
And the more we test, obviously the more expensive it's going to cost. But this doesn't even take into account the costs imparted to the patient when they get diagnosed, right? And so even if we make like screening policies universal, the problem is it still may not get translated in the real world to actual screening of a child in, say, an underserved region. So it is going to be a big challenge and a priority to make sure that first, when a child from a remote or underserved community is actually diagnosed, there's already mechanisms in place to handle the medical care, education, and just simply food access, right? I don't know if we're going to have all the answers for these right now, but all children, regardless of like their socioeconomic status, really deserve the opportunity still to get screened for celiac disease.
I completely agree with you. And you know, one of the issues we talk about with universal screening is asymptomatic people, which really most of the people are going to be asymptomatic. And the question then is, how should screening strategies account for silent cases to prevent long-term complications? Because it's okay if you do diagnose somebody and they don't have any symptoms, what's the motivation for them to actually want to do something about it?
Yeah, I think many people may think that they're asymptomatic, but what many screening studies actually show is that a large portion of people who were thought to be asymptomatic actually have unrecognized symptoms that improve on a gluten-free diet. So once again, I think that classification of symptoms is actually really complicated. Um, but some people are truly asymptomatic. And with respect to complications related to, for example, nutrition, bone health, and growth, which we think a lot about as pediatricians, we don't think that these individuals are really biologically different from children who have symptoms. And so a general population approach to screening will help us identify asymptomatic individuals and individuals with unrecognized symptoms to really help us prevent these complications.
Yeah, I totally agree. I think asymptomatic individuals should be screened just like anybody else. That's the purpose of mass screening. And this is probably where swaying public opinion, and perception of celiac disease is going to be really important. Individuals with celiac disease, regardless of symptoms, are still at risk of the complications of untreated disease. The issue here, the other big difference is going to be that we might need to pay more attention to things like diet adherence and quality of life in these situations, though.
For sure. So I want to talk about the difference between pediatric and adult populations. Should screening approaches differ between children and adults? And if so, how should screening guidelines be tailored for different age groups?
Yeah, I think this is an important question, especially as we think about, things like cost effectiveness and the cost of screening. And we have seen in studies of children at genetic risk of celiac disease that children are at the highest risk of developing celiac disease, at least in those studies, in the first decade of life. And this is not to say that you can't develop celiac disease at any point in your life, but I think really the most efficient screening strategy is really going to target this risk period.
Yeah, and for adults, like the screening process should be different, and it's great that you bring up the difference between pediatric and adult because sometimes we have the conversation about whether or not screening is a good idea or not. And one group is only thinking about the adult perspective, and the other group is only thinking about the pediatric perspective, right? And for adults, there may be more of like a patient preference approach to screening compared to a child, where you just might want to just screen everybody. So mass screening in adults may not necessarily take place, but maybe, for example, a process where testing for any adult for celiac disease is not only acceptable, but also offered.
Yeah, as an adult gastroenterologist, I understand what you're saying because I do think we look at it a little bit differently than pediatric gastroenterologists. But going, we just talked about peds and adults. How about primary care versus specialty care? So how can we better integrate celiac disease screening and routine primary care visits? And what role should the gastroenterologist play in guiding primary care providers on best practices?
Yeah, I would love to see every single celiac disease patient in my office, right? But that's not really feasible or realistic. Not all patients have easy access to gastroenterologists for follow-up care. That is the reality of healthcare here. And we really need to partner with local primary care providers to help address this, to ensure that everybody who has celiac disease is getting appropriate follow-up care with respect to monitoring adherence, monitoring their growth, looking for micronutrient deficiencies, and monitoring for any other co-occurring autoimmune conditions. And that's really something that we as gastroenterologists can help with in the community to make sure that primary care providers feel equipped to provide appropriate follow-up care for their patients with celiac disease.
Yeah, I agree. Integrating the primary care is going to be really important because um, there may not be enough gastroenterologists to take care of all the kids with celiac disease, and the primary care provider needs to be involved. And also in terms of timing, right? This is where they routinely see their doctors, and since blood draws in kids are oftentimes a big barrier, the timing of screening might even be coordinated with other recommended blood draws. For example, it'd be great to integrate celiac screening at the very least with their recommended lipid screening that takes place between ages of 9 and 11.
Absolutely. So when someone has screen positive for celiac disease, what are the best practice for follow-up care and ensuring that these patients receive the proper care and dietary guidance?
Yeah, so as part of our symposium, we actually tried to get an expert consensus on what the appropriate follow-up care is for people that screen positive for celiac disease. And as we were going through so many different scenarios, right? There are so many different scenarios that can come up. I think what we all agreed upon is that there is a role for shared decision making with families when you're counseling on positive screening results, and also counseling on what proper care is, right? That's going to look different for different families. Um, but I think as far as dietary guidance and next steps, for any individual that screens positive for celiac disease, you definitely want to make sure you keep eating gluten until you have spoken to a healthcare provider with expertise in celiac disease who can guide you on the next steps for diagnosis and management. And then I think the other key piece of this is kind of going back to the last question. Not everybody is going to be able to get into GI quickly. So making sure that we have really good partnerships with primary care providers so that they are providing appropriate guidance to, people who screen positive.
So what role do public health initiatives and policy changes play in expanding celiac screening efforts? And what steps should be taken to advocate for these changes at the state or the national level?
Public health initiatives and policy play a huge part in primary care. And so they definitely have a role in terms of advocating for integration of celiac disease screening into our preventive care. And we have seen that this has been key for other things that we screen for in the primary care setting. I'm a pediatrician, so I'm thinking about all the things that we screen for in the pediatric setting, but thinking about lead screening and lipid panels and newborn screening. Public health initiative and policy were key in getting those things implemented, and will be key in getting celiac disease screening implemented as well. I think in terms of things that we can do at this point, speaking to our political representatives and just making sure that they are familiar with celiac disease, familiar with the patient and family experience with celiac disease, and why early detection is even important, right? And so I think that those are the things that we can kind of start doing to help move the needle forward on celiac disease screening.
Yeah, this is a really important question. It's something that we keep thinking about in terms of how do we move forward. We don't want to just keep talking amongst ourselves in a circle, and how do we push this forward. And I do think, though, it still starts with the medical organization buy-ins and the patient groups to really help advocate and change like perspectives on this. But then concretely, we need to know like what the criteria are that need to be met in order to make this a policy. For example, the United States Preventative Services Task Force needs to be convinced. So this is where like our future symposiums need to get these organizations involved.
Absolutely. So, speaking of getting people involved, how can patients, families, and advocacy groups support advancing celiac disease screening programs, both through participation and public awareness efforts?
Yeah, I think screening and awareness go hand in hand. So, helping advance celiac disease awareness is going to help with advancing celiac disease screening. And there's already so much being done to help advance awareness, but I think continued efforts in that is really going to help us advance screening and engaging the community, making sure that you continue to help people feel invested in this cause and in early detection and awareness of celiac disease.
Yeah. Yep, same thing. I think continued advocacy and efforts to continue to change that public opinion on screening are going to be really helpful. And then also really important, again, like, if we're going to screen, we need to be prepared to take care of individuals who get diagnosed. And so I think this is where the patient organizations can really help us in terms of newly diagnosed patients when they live remotely. How can they get proper education and support?
So this is going to be kind of a two-parter. Looking ahead first, in 10 to 20 years, what do you envision as the ideal screening model for celiac disease, and how close are we to achieving that vision? But the second part is, what's the shorter term? What do you plan for the next year or two to do?
Yeah, so I'll start with the long term and end with the short term. I really envision a model where all children are screened for celiac disease as part of primary care, regardless of symptoms or high-risk features. And I think the work that we have to do in the next upcoming years, in order to make this vision a reality, is that we have to ensure, with respect to the implementation of this, we know really what that optimal screening strategy is. Is it a serology, as Ed alluded to, or is it, more genetic testing? Or, some of these advanced technologies and incorporating that into our screening. What is the optimal age for us to screen? Um, is it cost effective? And what of those screening strategies is going to be the most cost effective? And then do we have adequate resources and follow-up for individuals that screen positive? And I think those implementation features, those are the things that I would like to focus on in the next couple of years, because I think that's really what's going to help advance our vision.
And my thoughts on this are like, I think for kids, like screening in the future should really be integrated into routine pediatric care. And it shouldn't be just offered up passively as an acceptable thing to do. I think it should be really active screening. And it shouldn't be like a school or community-based program. I think it needs to be in the clinics where you've got like a provider there. Um, I'd aim for something like age 5 and 10. I'm just throwing it out there based on our understanding of the natural history of how quickly celiac disease develops. But screening should also take in consideration other autoimmune diseases that one might test for. It'll be cheaper if we combine autoimmune testing, especially type 1 diabetes and the right timing for that. So, the diabetes field has been pushing for mass screening for islet autoimmunity and early stage diabetes. And this is one of the reasons why we were prompted to also begin a mass screening symposium for celiac disease because the diabetes field is also considering adding celiac disease to their screening. So it makes sense that our goals are really um, they're in parallel, and so working with the diabetes field is going to be really important. And it's also possible that the celiac disease screening gets pulled up because of the diabetes screening. So it's almost like no matter what, it just may happen in the near future because of diabetes. And from that reason, we need to be prepared.
Yeah, this is a little bit out of turn, but I want to weigh in on that too. Back to our other question of how do we advocate? Our voices are really stronger together, right? So working with diabetes organizations and families with children who have diabetes and are trying to advance diabetes screening, that's going to be a really, really strong voice for advocacy. And our goals are really complementary. So I think working together will help spread the message that screening for both of these autoimmune diseases is really a good thing to help with early detection and to improve outcomes.
So kind of a follow-on, can you tell us what's in the future just immediately in terms of another symposium or what's your immediate plans?
I think it's a save the date. Marisa, it's November 12th, right?
Correct.
Okay, save the date, November 12th, Colorado. We're going to have our second annual celiac disease screening symposium. This has really only been possible because of the support by CDF and Beyond Celiac, and this is something we really appreciate. And this is like just ongoing wonderful collaboration with these groups that we intend on continuing. These symposiums are going to continue every year until mass screening is implemented. And even after that, we still would have a lot of work to do.
Well, that's
Well,
fantastic news,
yeah.
and we're very proud and honored to be a part of making this happen, and just grateful for all of the work that you're both doing and everyone at your center and all the participants to do this.
I second that, and couldn't have two better champions as well on the ground in terms of the pediatric GI community. So love working with you, and thank you so much for your time.
Thank you.